Hello, and welcome back to the AusCannaPodcast, where we explore cannabis through the stories of patients, insights from science, and voices shaping this innovative space right here in Australia. I'm your host, Christina McMullan. Today, we're diving into women's health. Not just the science behind it, but the powerful personal journeys that redefine what treatment really looks like. It's not about protocols or a one-size-fits-all solutions. It's about real people, real experiences, and the small but impactful changes that make all the difference. Ever wonder what it feels like when treatment is tailored just for you? Stay tuned, because today's guest, Neda Beric, works at the forefront of personalized cannabinoid therapy for women's health, collaborating closely with prescribers and patients to develop compounded formulations tailored to individual needs. Her approach centers on real-world feedback, using patient experiences to redefine and optimize outcomes over time. At CannCompounding, she plays a key role in bridging the gap between clinical intent and patient reality. And the stories and insights she shares could change the way you see medicine and yourself. But before we get there, if you have a burning question you've always wanted to ask a guest on the show, well, now's your chance. Send it over to AusCannaReviews@gmail.com. And don't forget to include your mailing address, because if your question gets aired, I'll be sending you a special goodie bag as a thank you. All right, let's kick things off with my favorite part of the show, the not so rapid fire question segment. All right. Are you ready with some rapid fire questions?
Oh, yes, I am.
Okay, here we go. Go to comfort meal after a long week.
After a long week, it varies, but I can definitely say one thing that got me through a lot of stressful weeks, which was the Nutella jar. I wouldn't call it a meal, but the Nutella jar and a spoon and just straight for it.
I love it. Where do you go mentally when you need to reset?
Mentally, I think I just try and go inwards a lot. Just to sort of think, where am I? What's happening? Try to sort of rephrase everything that's happening around me. And then I sort of use that as a time to sort of clear my space, because then that clears my mind. I like to then go to the beach as well. And that sort of all helps to reset me and keep me going.
I love it. What's something small in your daily routine that keeps you grounded?
That keeps me grounded. At the moment, this is so strange, but it's my unwind at the end of the day. I've gotten into frosty fruit ice blocks. I have my frosty fruit in the evening and play some Sudoku. And I think that's what stabilizes me at the end of the day. And then I just thought, okay, the day's done. Now I'll move on to my nighttime routine.
I love it. Sweet
Yeah.
tooth again.
Sweet tooth again. But that's, a bit of a niche phase I'm going through at the moment.
One cannabinoid you think deserves more attention in women's health, and why?
CBG. I love CBG. It's got great anti-inflammatory properties that we've seen. And I just think it could be incorporated into a lot more formulas, especially when we pair it with other cannabinoids and just really focus on that entourage effect.
Love it. A conversation that's changed how you think recently.
Um, I think a close friend of mine reminded me of something that Alan Watts said, which is you're under no obligation to be who you were 5 minutes ago. And then, yeah, it's good. And then I just try remind myself of that often, just to sort of tell myself, well, you can pivot if you don't like it. change this, change the way you think. And it's, I guess, bringing it back to you rather than what's happening around you, because you can't always control everything around you, but you can control your reaction. So the practice on it is, it's a work in progress, but it's a nice reminder to kind of keep working on that and just sort of, use that to guide me a bit more.
If you had complete freedom to design a formulation, what would you explore?
What would I explore? Oh, I think just a nice mix. I guess in compounding, we do have that freedom, and sometimes we get to play around with formulations, which is really exciting because I do work in a compounding pharmacy. But I like a bit of everything, and then I think it always depends on the patient, the symptoms. So I think it's a quite a layered question in that sense. But yeah, I think a bit of everything in there is nice.
I like that answer. You're right. There's lots that you can do there.
Yeah, yeah, for sure. And definitely tailoring it. I think tailoring it is the big thing.
A delivery method you find most effective in practice right now.
Um, right now, I think they all stand out in their different ways. I always just like oral liquids. I think they've just got a good baseline for patients. And same as just gummies. I think sometimes just those oral delivery methods that just kind of help provide a nice baseline of treatment are great. Yeah.
A woman's health topic you think needs more attention.
All of them. I think just women's health in general. Um, yeah, women do a lot all day. So I think, they give attention to everyone. So I think it'd be great just to put more attention on women and the times they silently suffer. I know with a lot of just the women in my life, they're not quick to complain on something bothering them. It's sort of just like you keep going, and they're the ones that probably need more attention than we think, because they just sort of, yeah, push through.
We do push through. It's so true.
Mm.
What's something patients care about that clinicians sometimes overlook?
Patients, I find, always care, especially women, about the driving laws. I wouldn't say clinicians overlook it, but in terms of, I think there's a lot more we can do in that space if a patient is concerned about driving, and particularly with THC. I think that's where we can look to other cannabinoids. So I think the options maybe are overlooked in that space. There are other options where we don't need to use THC if a patient is particularly concerned about the driving laws. So I think some of the options maybe can sometimes be overlooked. Yeah.
That's an excellent answer. You're right. I
Mm.
think there are a lot of options out there that sometimes as patients, we don't even know what the options are sometimes.
Yeah. Yeah, that's it. Yeah, and I think that's where we all get to step in as healthcare professionals and kind of share some of, um, I guess, the knowledge there. Yeah.
So, last question,
Mhm.
listener submitted question. And this is from Henry in Airlie Beach, Queensland. And he wants to know your simplest explanation of cannabinoid therapy to a first time patient.
I like this one, and this is the way I normally frame it to patients or people that you come across that hold some stigma. I like to sort of say to them, so when you take a normal medication or any other drug that's on the counter in the pharmacy, you take that medication and your body has receptors. So when that drug elicits a response, it binds to the receptor and it will either enhance a response or block a response. So our body has an endocannabinoid system. So, and then this plant, cannabis, it grows from the ground. So for me, I always like to think that we're sort of like genetically made to take this plant because it's from the ground. We have a receptor system. So if you kind of bring those two together, those plants can sort of work to bring that system back into balance. Because what we sometimes find is that the endocannabinoid system can sway out of balance. And then we just want to bring it back into homeostasis, back in line. Um, and that's sort of where I see a role for cannabinoid therapies and how much they make sense. And I think it's a good way to explain it to people to sort of think, okay, maybe it's not so taboo. It's as simple as we have receptors, it grows in the ground, it makes sense that we bring them together.
I love it. Neda, thank you very much for playing rapid fire with me.
Thank you.
So there are lots and lots of things I want to talk about today. Um, but we're going to start with women's health because that is your specialty. And as we were talking earlier before we turned on the mics, it's definitely an area that doesn't get enough attention. To tie into Henry's question, when did it first click to you that cannabinoid therapy could play a role in women's health?
Mm. I think, I guess we see a lot of women suffering with different conditions. So if we take endometriosis for an example, we know that about 1 in 9 Australian women suffer with endometriosis. And if you start to think about conditions like this or adenomyosis, vulvodynia, a lot of them are conditions where patients experience chronic pelvic pain. And with that pain, they might have associated symptoms like anxiety, depression, sleep disturbances. So you sort of start to see what we're treating other patients with and what other patients are presenting to the pharmacy with other conditions. So that those patients might be presenting with things like anxiety, and we're treating them with cannabinoid based therapies. And then you sort of start to see that overlap in women's health conditions. And then I think you hear the horror stories of women who feel like they're unnoticed or their symptoms and pain is dismissed. And that's sort of like, they present to their emergency department, they're having an endometriosis flare up, they give them some paracetamol, they're told, oh, the pain's not that bad, but, these women are truly suffering. And I think it sort of makes us start to think, well, is there anything out there beyond conventional therapy that we see? So often you'll see patients use things like non-steroidal anti-inflammatories, opioids, you might see them on hormonal therapies. So we sort of start to think, okay, is there something else we can give them? And that's why I think a lot more research is needed in the area of cannabis and women's health conditions. But I think knowing where the ECS plays a role, and that it does play a role in things like pain modulation, inflammation, hormonal regulation, we can start to think of it as a logical target for these conditions. So, yes, I think having a bit more research in this area would further highlight that, but it sort of makes us think, hang on, maybe there's something here.
Do you think women's health is being underserved when it comes to cannabinoid therapies?
I would say so. Yeah, I would say so. I think maybe stigma ties into that. Patients not knowing that it's a potential option. Yeah, for sure.
What do you think we're getting wrong, though?
Probably education. And I think research. I think maybe there's a bit of underfunding, under-researched area. So if we could bring more light to that, you know, we could see more studies and things emerge that would sort of help point us back that way.
Where do most of your patients come from? Because you work in compounding, it's not necessarily a product that's readily available that sits on a shelf, right? You're tailoring things to individual patients. So, because you're tailoring things to individual patients, how do people learn about cannabis compounding? Is that just a conversation that they say to their doctor one day? Hey, maybe we can compound some stuff together. Where would their conversations start?
Yeah. So I think this is where my role is quite exciting. So at CannCompounding, I work as a women's health consultant pharmacist. So part of my role is speaking to both prescribers and patients about these therapies and different options and things like that. So I think that often starts with potentially the prescriber. The prescriber and I may have had a conversation. We've discussed different dosage forms and the potential of what we can do with compounding. The prescriber then might trial this patient on a certain formulation that we've put together. Sometimes we have a conversation where they'll reach out to me and say, I've got a complex case. What should we do here? How does this sound? And then we sort of go from there. There's a lot of trial and error in cannabis. So we have a starting point, and then that's when the patient will come in or the patient will send us their prescription. And then we have a conversation from there to maybe set some expectations, educate them on how to use their dosage form. And from there, I always like to check back in with the patients to see how they're going. And then we can potentially pivot formulations, in line with the prescriber and sort of say, well, hey, they've had this response. This is great. They might stay on it, or they're not getting enough pain relief. What can we do from here? And we sort of work our way from there.
I love it. Can you maybe walk us through a patient journey from maybe first consult that you've had with them? Because you're saying trial and error. How does that go?
Yes. So there's a prescriber I work quite closely with. The patient had seen the prescriber and they were started on some pessaries as a different dosage form. I think we were just exploring different options, because there is a potential for pessaries to be a suitable dosage form in pelvic conditions. For those people that don't know what a pessary is, I often say to patients, do you know what a suppository is? And a lot of people are familiar with that. And a pessary is the same, but it just goes in the front end. With a lot of women's health conditions where the symptoms are targeted in the pelvic area, that's where pessaries can potentially be beneficial. And anecdotally, we've seen, patients respond well to them. So basically, the patient will insert the pessary into the vagina. So this delivers the drug directly to the uterus, vaginal wall, and pelvic floor. So by using that delivery method, we bypass first pass metabolism and prevent any breakdown of the active ingredients. So it means the concentration of the drug or active ingredients is in the pessary and it's working directly to sort of relieve symptoms there. So it's a bit more of a targeted approach. So in line with the prescriber, we started her on a formulation of pessaries. So she'd come into the pharmacy, we'd counseled her, she knew how to use the pessaries. She went off, she used them during the time of her menstruation, because that's when we often see that symptoms are a bit stronger in terms of pain. She trialed the pessaries then and then found that they weren't quite enough. So then that's where I sort of take that as an opportunity, because I work quite closely with this prescriber, to sort of relay back to her and say, hey, maybe we need to speak to her again and maybe we can change it and increase this or add this and go from there. And then we were able to create a new formulation for her, get a new script, and then from there, try something a bit stronger, which she could have more success with.
I love it. You mentioned hormone cycles.
Yeah.
I think that's something that we don't talk enough about. I mean, there are definitely some women I know that educate on this topic that are like very in tune to their cycles and know exactly what they need during different parts of their cycles. I'm slightly embarrassed to say I'm not that in tune, which is really weird to say, but I'm not. But from your experience, what does that actually look like in treatment?
Yeah, so I think this is an interesting area, and I think it's quite underexplored, and I'd love to see more work in this space. So as we know, all women have a hormonal cycle, and their hormones fluctuate throughout the month, and then this can fluctuate their mood, it can fluctuate their pain, all of those sorts of things. I find this is where symptom diaries are really important. One, not only with your treatment, but also just understanding your cycle. Because if you can try and understand your cycle a bit better, you can understand what your needs are in each part of your cycle, or understand, maybe this is a time for rest. This is a time when I'm most productive and things like that. And then we see that there is a bit of interplay with hormones and cannabis. So we know that estrogen can be a bit of an amplifier. So if there is a point in your cycle where estrogen is a bit higher, we know that patients might be a bit more sensitive to THC during that time. And then progesterone can be a dampener of the cycle. So as you move through the cycle and there's these fluctuations, it means the patient's needs change. So I think that's quite an important consideration in treatment as well, which I would love to see more of.
Um, as somebody who no longer has regular hormonal cycles, God bless perimenopause, how would I potentially, because now, like I said, there's no ebb and flow anymore to what's going on in the
Yeah.
hormones. How do I try to pair it now?
Yeah. Perimenopause is very tricky because it's unpredictable fluctuation. But I think this is a great time for patients to have a few options in treatment. And then it's kind of, they need to guide their therapy a bit in that sense. So I think it's important that they understand the role of each treatment and, like, say, if they've got a high THC product, how that can affect them versus a lower THC product, and kind of even balanced products, and how different products can be beneficial during different parts. And I think because it is unpredictable, say with a regular cycle, we can predict it a bit more. So we know when estrogen rises, that's probably when we want to drop off THC a bit more. During menstruation, say, that's when we might need a bit more support for that patient. That's when their breakthrough symptoms might be higher. We might need something with a bit more like anti-inflammatory properties. But when we contrast that to perimenopause, where things are just all over the shop, I think it's just about guiding how you feel and understanding, what you can do when things are feeling a bit like this or a bit like that.
I know that before my cycle got so crazy, I would definitely load up on the CBD like a few days going
Mhm.
into my cycle. I know that sometimes, and maybe this is just a girl thing or woman thing, that we tend to not medicate until we've reached our threshold. Right? Like we're already in pain. I'm a bit of a train wreck when a period comes, in a sense that, and sorry, gentlemen, if this is just too much information for you, but I get migraines. I'm in the fetal position on the floor underneath the hot shower. Like I don't have endometriosis. I have adenomyosis. Like I've got polycystic ovary syndrome. I got a lot of shit
Mm.
going on. So
Yeah.
you're not good. But it took me a while to realize that, oh, I don't need to be medicating. I mean, yes, I need to be medicating myself when I'm in the fetal position on the ground, like crying in the shower. But the key is I should really be like loading up on my CBD several days before my period. And it took me a long time to kind of figure that out. From your perspective and the patients that you're dealing with, what is, I guess, a first sign that something isn't working?
I think every cycle might vary as well. Based on lifestyle as well. So I think that's always important to look at the whole picture as well. Sometimes it's your like the stresses in your life, diet can play a part, and they can sort of flare things up. So sometimes from cycle to cycle we see variation based on those things, which is beyond hormones as well. But I think, if patients, this is again where symptom diaries are quite important. Log your pain scores, like, rate your pain on a regular time. Let's bring in a treatment and let's then compare next cycles after you've been taking a treatment, what your pain score is. And are things like that moving? Is it moving down? Is it staying the same? Like if it's moved down, that's great. We've seen an improvement, but then it's also based on things like, your quality of life. Some women are in so much pain, they can't move, like you say, you're in the fetal position, you can't get out and exercise. Or some women are in so much pain, they can't even go to work. So are we even moving the marker on things like that? Okay, this cycle I wasn't bedridden, like I could get out and move. So we're kind of, I think it's important. Yeah, I think that's where symptom diaries are really important, and kind of making sure patients track those sorts of things. And that's where we can have those conversations with them and see, all right, has this improved? I think expectations are important there as well. So when we consider, like, when you're initially talking to the patient, talking about those sorts of things rather than expecting them to go from full blown pain to pain zero. And sometimes it's a bit of a work in progress to get there.
I say it all the time. There is no faster way to improve your therapeutic outcomes, then journaling. You got to write it down. How do you know?
Yeah.
Write it down.
Yeah.
How quickly do you adjust? Like if you think a product's not
Mm.
working for you, do you drop it right away or do you need to ride it out for a little bit?
I think at least seeing how something goes for one, like you want to see at least for a cycle, maybe consider a second cycle. But if the patient's still completely struggling through that cycle, that's probably where you want to see, if there was improvement, then I think, all right, let's see how we go a second cycle. But I think if it was still hell for that period of that month, that's probably where I'd want to intervene and like let's all have a chat again, the prescriber, the patient, and the pharmacist, and see what we can do from there.
What's the smallest tweak you've made that led to like the biggest improvement?
I guess sometimes it's as simple as just bringing in an additional cannabinoid potentially, or increasing the dose of, increasing, or sometimes it's as simple as increasing the strength of a cannabinoid in the formulation.
See, this is what fascinates me so much about like the work that you do because it might just seem like it's a simple little tweak, but again, it's a big improvement to somebody's therapeutic outcome. Um, Out of curiosity, how do you collect patient feedback? Does it just come back from the like is it because I'm big on having conversations with your prescriber. So is this something that is a patient talking to you guys at CannCompounding directly, or is it again encouraging them to have the conversation with their prescriber and the prescriber is in turn having the conversation with you?
I think it's nice to have a open dialogue between everyone. I guess in pharmacy, you're in a position where you're probably going to see the patient more often or have more frequent touch points with them compared to their prescriber. Initially they'll see the prescriber, maybe they'll have a follow up in 1 month, and then from there it might be 6 month follow ups. Whereas in the pharmacy, you can see them a lot more frequently. So that's where I sort of like to touch base with them. I will call patients as well. So I kind of know, all right, they come get their medication or we've done the first supply. I'll kind of chat to them. All right, they're expecting their period in 2 weeks. So I might give them a call in 3 weeks' time once they've kind of got through that period, just to see how they went with their therapy and yeah, what we can do from there.
Do you see any patterns emerging?
I think everyone's very individual. Yeah, I think that, and I think it's all a lot more complex. Like even talking about lifestyle and stuff, everyone's got different burdens they carry in that respect. So I think there are sometimes patterns, but I think there's a lot of, we need to treat patients as individuals. And I think that's where I love compounding because it gives us the opportunity to do that.
What do patients usually say when something finally works for them?
They're my favorite conversation. I love them. I think you kind of just almost have this like sigh of relief that you hear from them, like, oh, you know, I could do this, or like, they're like, and sometimes it's subtle, I guess, like, because really they're just going back to doing normal things, like, oh, I was able to do XYZ, or I didn't have to call in sick from work because things were more comfortable. But you get that initial sigh of relief, and then you can almost see if it's a phone call, you can almost just feel their smile beaming through the phone. And I think they're the things that are really rewarding, and probably that, keep us coming back to work each day.
Netta, you said something really amazing right there, and I don't even think that you realize that you said it. 2 seconds before, you were talking about how challenging cannabinoid therapy is and how everybody's different and we're all challenged and how we all need to be, handled differently. But then I asked another question, and your response was, everybody's just happy to be normal,
Yeah.
right? We're all so different, but we just want to feel normal.
And like you can function.
Yes, we just
Yeah.
want to go out and be a productive member of society. We just want to go to work. We just want to walk the dog. We just want to hang out with our grandkids,
Mhm.
whatever it is.
Mhm.
And like I said, I don't think you realize that you said that. And I think Man, that's why the podcast is so important. That's why what you do is so important. That's why we got to get louder in this space because we are so different. But this is a magical plant that, given the opportunity to embrace it, a lot of us do feel normal after.
Yeah, and it's funny, because I think when you just come back to that normal, you almost forget how bad things were, because you're just like, "Oh, this is how it's supposed to feel." And it's like I feel like for some patients, it's almost like a subtle shift back because it's just like, "Okay, this is how things are supposed to feel," in that sense, yeah.
Yeah, because we lose ourselves.
You do. Yeah, yeah. And I think some of the stats with these things are crazy as well, like, you don't realize the impact and the burden that, like, say, a woman with endometriosis might go through. I think it's about estimated that on average, they'll spend about $30,000 a year on their healthcare, and so the burdens they carry with those, financially, there's the physical symptoms, the mental symptoms, the financial burden. They can't go to work. These are all little things that, the rest everyone else sort of just does, and we, don't take for granted in that sense. Yeah, so I think just being able to just carry out those activities of daily life and just enjoy yourself is really important.
It's super important. It's super important, right?
Yeah.
It's why you do what you do.
Yeah, for sure.
Um, what do you think is something that patients wish their doctors understood better?
I think there's a lot of good doctors out there, and the patients that I see, I think a lot of them do feel heard. But I think in general, some patients just feel like they want to be heard, that their symptoms are real, that the pain is that debilitating. So I feel like there's definitely that in general, but I think a lot of the doctors that we see and that we work with are really good at acknowledging these things for patients and, yeah, attending to it.
Where do you think this space is heading?
It's hard. I think, the industry is always under a lot of scrutiny. Um, there's always things happening in the regulatory space. I know where I'd like to see it heading. I'd like to see more research, more funding, so then we can really, like, further sort of, share the benefits of the plant with patients and um, just regular prescribers. So those that aren't already authorized prescribers or working in this space, I'd like to see it maybe a bit more normalized and considered as a option. And I'd like to see more work with minors. The down scheduling of minors would be great. And then just acknowledging, like, there's so many different dosage forms. There's so much that we can do, especially in the way of compounding and just making those sorts of things a bit more normalized.
I'm with you. Big on the normalized part. Big on the normalized
Yeah,
part.
it's a bit of a theme here, isn't it?
It is.
Yeah.
I would be super happy too if we could downschedule some minor cannabinoids.
Yeah,
I think that's a huge area of opportunity.
for sure. For sure.
Um, when it comes to innovation in the industry,
Mhm.
who do you think is driving it?
Um, I feel like the patients almost should drive it more because at the end of the day, it's all about the patients, That's why we all come to work because they're the one, we're doing it for the patients. So it should be driven by the patients. And I think hearing more patient feedback would be a great way to look at where to pivot things and where we should drive things. Um, Sometimes I think what's happening overseas can sort of impact, we can look at those trends and maybe gives us idea on what to do or what not to do. But I think open conversations with everyone is a great place to drive it.
Is there anything that's happening overseas that you've been watching that you are thinking to yourself, oh man, that would be a great delivery method here, or wow, that would be a great product if we could just get it on the shelves here. Is there anything that's caught your eye that you would hope would come here?
Something that we do have here at CannCompounding, which was brought in from overseas, is fast-acting formulation, which I think is really exciting. If a patient takes an oral dosage form, they normally report onset of action within about 1 to 2 hours. So sometimes we want something that's going to work a bit faster for the patient, especially when they're having breakthrough symptoms, that isn't an inhaled dosage form. So we have a fast-acting technology here, which allows us to encapsulate the cannabinoid in a nano emulsion. And then that can be absorbed through soft tissue, meaning it bypasses first pass metabolism. So with that, we see patients report an onset of action within about 15 to 30 minutes. And I think that's something really exciting. It's not always practical to have, an inhaled dosage form with you. So if you've got, like, say, a fast acting gummy and, you're in pain, you're having a flare up, you're out and about, you can take that and get quicker relief of your symptoms rather than waiting, an hour or 2 hours for something to kick in. So, yeah, I think there's definitely exciting things like that have come over, which is really cool.
Yeah, anybody who listens to this show knows I'm a big fan of nano emulsion. Big fan.
Yeah.
Pro tip to any listener who is listening. Another thing that you can do with your gummy, I think it works with regular gummies too, but it works really well with nano gummies, is if you put it in a glass and fill it with just enough warm water to cover your gummy, and then mix it until it dissolves completely. Because it's a nano emulsion, it is water-based, so it will dissolve in there. And then you can take it like a shot, and that will increase the onset time. I'm sorry, not increase the onset, it will shorten your onset. Speed it up is what I meant to say. So again, if you're in a situation where you need to speed up the onset even more, there's your pro tip.
Very interesting.
Yeah, pro tip. That's why you listen to the show. Tips all around.
And that's why you listen to the patients as well.
Yeah, I mean, look, that was something that I again, because I'm big on the nano emulsions, I've talked about it on the show before. I'm someone that suffers from the first pass effect. I struggle with edibles, and nano emulsions were like this amazing thing that allowed me to access a delivery method that I thought was off limits to me. Not off limits, that's not what I want to say, but was unattainable for
not an option. Yeah.
Sure. If my prescriber had just given up on me, or if I had just given up, I would have never gotten to this point to where now I'm like, they're amazing.
Yeah. And you bring a good point there about giving up. And I think that's something why I always like to touch base with patients. And I think kind of that feedback is really important because there is trial and error, when you start with medicinal cannabis. And if the first formulation doesn't work, there is that temptation for patients to give up and say it's not for me. And that's true. It isn't there is some truth there. It isn't for everyone. But I think there is room to pivot with formulations and dosage forms. So we can maybe try something else without them giving up and missing out on something that could have potentially brought them, control of their condition to help them with their symptoms.
I tell people all the time that it's like taking an allergy medicine on many, many levels. One, sometimes the first allergy pill you take doesn't work for you. So you've got to go through like 4 different ones before you find an allergy pill that like ticks off all of your symptoms and, your happy days. The other thing that it's like that I draw the parallel with is sometimes you don't realize how well CBD is working for you until you stop taking it.
Yes. I love to tell patients that too.
Yeah. Just like an allergy pill.
It's subtle. And if you stop, that's probably when you'll see how much it really was doing for you.
Yeah, like I said, I use that analogy all the time, just like an allergy pill.
Yeah. And I think that ties back into what we were saying before about feeling normal again. That's why it's so subtle, because you just kind of like, this is how I'm supposed to feel. And you kind of forget that it's what's changed and what's helped that. But yeah, it brings you back to normal.
Yeah. Yeah, the importance of normal.
Yeah.
If a patient listening right now feels like nothing has worked for them, what would you want them to know?
What would I want them to know? That there are potentially other options, I think don't give up. I think that's important, not to give up. Have a conversation with your prescriber. Maybe do some self-reading and learn about some other options for you. You can give a pharmacy a call. There's a lot of us cannabis specialist pharmacies that are willing to speak to patients, and there's things to consider there.
I love it, Neda. It's so true, though.
It is. And you're not alone. There are other people that are willing to listen. Like if you've been dismissed before, there are definitely people that are willing to listen and that want to help. Yeah. And do believe that your pain is real and your symptoms are, causing you a lot of distress and taking you away from normal.
Normal. It is the reoccurring theme of this episode.
It really is.
I cannot thank you enough, Neda, for sitting down and chitty-chatting with us. You shared so much knowledge with me. I love it. Final takeaway. If someone has one thing that you want them to take away from this episode, what should it be?
So a final takeaway, I guess, would be, I think let's all do our bit to reduce stigma in this space. I think there's a lot of it. And let's go back to what we spoke about at the start. Makes sense, our body and the plant. And, there are potential options that may help with your conditions. And yeah, I think it's really important to have a chat with your prescriber or with your pharmacist and explore them.
Yeah, man. Don't be afraid of the stigma. Have the conversation.
That's it. You too can feel normal.
Cute. I love it. I love it.
And you deserve to.
Yeah, girl. I like that one. Where can listeners go to learn more about what you're doing?
Our website is probably a good start. So I'm a pharmacist at CannCompounding, so they can jump onto our website. We are on socials as well, so Instagram, LinkedIn. They can always give us a call. We've got our email addresses as well if they feel more comfortable reaching out via email. And yeah, I think even if they pick up the phone or send through an email, we can kind of explore from there.
Thank you again, Neda. It was an absolute pleasure. I'll make sure all that information is in the show notes. You have been an absolute delight. Thank you for your time.
Thank you, Christina.
And that's a wrap for this episode. If there's one thing I want to leave you with, it's this. If something hasn't worked for you, it doesn't mean there isn't a version that will. It just might not have been tailored to you yet. Because at the end of the day, what so many patients are really chasing isn't anything extreme. It's just normal. Being able to get through the day, go to work, show up for the people in your life, feel like yourself again. And sometimes getting there isn't about a complete overhaul. It's about small changes, the right support, and somebody actually listening when you say, "This isn't working for me." A big thank you to Neda for joining me on the show today, for the work she's doing, and for bringing a level of care and intention into a space where so many people still feel overlooked. If this episode resonated with you, share it with someone who might need to hear it, because chances are someone in your life is quietly dealing with more than you realize. And of course, if you want to support the show, you can do that at buymeacoffee.com/AusCannaPodcast. Until we meet again, friends, thank you for taking time out of your busy schedule to listen. And remember, you can be a masterpiece and a work in progress simultaneously.